Bregman. How are you doing today?
Good, Linda. How are you?
Looks really sunny where you're at.
Well, the wonders of technology.
You can be anywhere.
I wish I was here, but it's
actually
really,
it's probably raining where you're at.
It is. I'm sure it's raining where you're at too.
I know. There you have it. There's Florida. Well, we have a patient question like we do every week, and we all invite you to write Dr. Bregman a question with any problem that you're having, and we'll make sure that Dr. Bregman addresses it. Today we have a question from Kevin. He comes from Ohio, and he says, Dr. Bregman, I'm working from home due to COVID-19, the days of COVID-19. And he says about 2 years ago, he was diagnosed with adult ADD. And he says, right now, I find that my meds are not working the way they should be. Maybe it's because I'm stressed being at home. What's your advice?
Well, Linda, Kevin, I have been overwhelmed in my practice lately with exactly what we're talking about. Now, one of the things that's intriguing about ADD at this point is when people are under a lot of stress because of what's going on in the virus, or they are working at home, which is a new situation, they are much more inattentive. So one of the things I'm seeing is that where the maintenance dose of their ADD medicines worked initially, now we're seeing that it is ineffective. Also, there could be a reoccurrence of underlying pathology. Maybe these individuals had issues of depression or anxiety before, and a lot of people have also comorbid or associated disorders with ADD. And that's how I've been very successful in treating these individuals, because if you also treat some of the underlying disorders, anxiety, depression, then people can tend to have great results. But during times of stress like this, that is when you may need to see your practitioner again and adjust some of your medicines, not only the ADD ones, but also others that you're using for other mood disorders or anxiety disorders, etc.
Just out of curiosity, why would a medication work for years and then all of a sudden it's not working?
Well, that's an excellent question. And I think that's why we continually follow up with our doctors. People say, doctor, why do I have to see you, this often? Because things change. As people's life circumstances change, as we see lately, then some of their underlying pathology can change. And as I mentioned before, people who have ADD, when they're under a lot of stress, become more inattentive. So they may need a higher dose of medicine, or some of their other issues are now surfacing and they need to be addressed.
Well, you mentioned to me that this is actually a pretty easy problem to fix relatively.
Absolutely. I think, some of us people are under the assumption that, if you change your medicines, it could take a month or it's going to take weeks. That is really not true. I have seen people, even with antidepressants, you increase their dose 4 days, they're better and they're more attentive. Increase their ADD medicine, they're better the same day, and they don't even have to wait. So in terms of medical management and going back to the doctor and seeing what's going on currently could really help the situation. So I would strongly recommend to Kevin that he get with his doctor ASAP and see if he could benefit from some adjustments.
Absolutely. It sounds like an easy fix.
It is. Kevin, he's got to get on there and go right to see his doctor as soon as possible.
Great. Well, thank you. Thank you for Kevin, and thank you for everyone out there. And it's always good seeing you, and I'll see you again next week.
Oh, great, Linda.
BregmanMD Medical Group offers online psychiatry and online therapy.